Okay, so I'm going to give a mostly historical talk because you've got some excellent speakers behind me to talk about the details of how TTC is used. I'm basically here to address two questions. One, how we got here, and why we got here. And the answer to the latter question really comes down to the regulatory challenges surrounding food packaging and food flavors. With respect to food packaging, the regulation of which in the U.S. started back in the late 1950s, one of the driving forces in FDA needing to, and the industry as well, needing to have a way of characterizing compounds by potential concern were improvements, continuous improvements in analytical methodology, where analytical chemists were able to detect lower and lower amounts of substances migrating either out of packaging or becoming contaminants of food. And there was a need to apply a common sense approach to applying resources to questions based on the likely risk. But that framework, one of the challenges early on was that framework really needed to be risk-based. There's a temptation to draw a line with respect to analytical sensitivity or based on other approaches. But FDA was never able to adopt an approach because it was never able to relate any of the levels that I'll be talking about until the mid-1980s to potential risk and likely consumer exposure. So probably the first two attempts at threshold-type risk management approaches were a proposal by William Frawley, an industry toxicologist in the 1960s. Dr. Frawley's employer was a significant manufacturer of food packaging material. So he set out to determine whether or not there was a generally safe level of migration of packaging components into food. And he collected, along the lines of what we've seen later with the TTC approach, a significant number of studies on a variety of chemicals, generally believed to be probably all of the available, publicly available chronic data at the time. He evaluated this data using a typical 100-fold safety factor, and discovered that generally speaking, 100 part per billion migration level would be an acceptable level with respect to the no effect levels and safe doses estimated for these 220 chemicals. The only chemicals that might possibly be of concern below this level, based on his analysis, were a few pesticides and heavy metal compounds. Liesl Ramsey, who was an associate commissioner for science at FDA in the 1960s, put forth a proposal from within FDA, which strangely was not risk-based. It was based on migration, 50 parts per billion migration, and generally more based on the limitations of analytical sensitivity. Still, the 50 part per billion migration level is one that is still a benchmark with respect to food packaging because it does represent a relatively low consumer exposure when you factor in market penetration. So what changed with respect to these various approaches really was the evolution of large toxicity databases in the 1970s and 1980s, particularly databases such as the IRIS database and the so-called GOLD database, the carcinogenic potency database. So in light of the large amount of data that was available to do a more thorough analysis on a more representative set of chemicals than Dr. Frawley undertook, FDA began asking, specifically the food packaging folks, began asking themselves the question of whether or not they could determine a dietary exposure level that they could use as a benchmark, which was likely to result in negligible risk for an untested compound, since chemicals with these very low exposures are not typically held to be tested for carcinogenicity effects, if that substance were later tested and shown to be a carcinogen. FDA moved forward assuming that cancer was the endpoint of most concern, and that's primarily because, like EPA, FDA regulates carcinogenic risk by extrapolating to a very low risk, a 1 in a million or lower risk. And so the agency analyzed the available carcinogenic potency data from the carcinogenic potency database probabilistically. And in 1987, Alan Rulis published an initial paper on this analysis where he had pulled data from the carcinogenic potency database that had been tested orally, that had dose response data that allowed the derivation of a tumor dose 50. That is a dose that analogous to the LD50 that results in tumors over the lifespan of the animal in 50% of the animals. And for which that TD50 had a minimum statistical significance. And so there wasn't really any in-depth analysis of mechanism, of any other factors toxicologically. This was a worst case database, so to speak. And potency was modeled very simply as 0.5 over the lowest TD50. What that analysis revealed was that potencies, when they're graphed logarithmically, form a normal distribution. And so what we know from that is that we can with some confidence predict the range of potency for chemicals overall, assuming that we have a robust enough data set. The selection of a consumer exposure level, an actual threshold, however, based on that probabilistic distribution, took into account a number of factors. The fact that the database was using only the lowest TD50, that to determine a 1 in a million risk level, the agency was using a linear extrapolation, worst case extrapolation. And also, the agency considered its knowledge of how exposure assessments were conducted, how conservative they typically were to chemicals migrating from food packaging. And the agency formally proposed its threshold of regulation of 1.5 micrograms per person per day in 1995, but it in fact been implementing that level for about 4 years previous. Now, unlike the non-cancer portion of the TTC, this threshold, which is one of the low thresholds in the TTC framework, is based is basically a risk management level. It's roughly equivalent to the level within the database where 1/3 of the compounds Let me move on to the next slide here. Let me show you a little bit better. This is a graphical representation. I'll make sure I've got this not transposed. On the right-hand side are graphed the log of the TD50 for over 700 carcinogens that were extracted from the CPDB database. And the left-hand graph is simply that plot transposed 6 orders of magnitude to the left to represent a graph of 1 in a million risk levels, or virtually safe doses. And we see this half a part per billion level. I can't see it on the slide. Okay. This half a part per billion level is roughly cutting the curve 1/3 and 2/3. And so worst case, 33% of the compounds in the data set have the potential for resulting in a risk of 1 in a million or greater. And 2/3 are relatively certain to result in a risk much lower than that. So the other part of the challenge that got us here was the challenge of dealing with food flavors. Food flavors are probably the largest discrete group of food ingredients available. There are thousands of discrete chemicals. Most are in food at very small quantities, and their use is self-limiting. A little bit of a flavor makes a food taste good. Too much makes it unpalatable and inedible. And many of the chemicals are synthetic versions of what's naturally present in the food. With respect to foods, and I think Sean is going to talk a little bit more about this, with respect to flavors, the industry decided in the late 1950s that they were going to take advantage of the ability under the U.S. Food and Drug Law for manufacturers to make determinations that the use of a substance is generally recognized as safe based on publicly available information or based on history of use. And flavor manufacturers established an expert panel and a well-documented review process and a process for publishing the results of the assessment to determine whether or not these low levels of flavors were safe and that safety was generally recognized. And that process evolved over the years and resulted ultimately in a publication by Cramer, Ford, and Hall in 1978 that described the structure-activity portion of the analysis that the Flavor and Extract Manufacturers Association conducted. And the principles in that particular decision framework, the Cramer decision tree, were that toxicity is conferred by structural groups. They considered whether the substance occurred naturally in food or was produced endogenously in the body, and what was known about the metabolism of the substance or similar substances. And the decision tree is a collection of over 30 questions about chemical structure and reactivity. And they divide chemicals into 3 reasonably well-defined classes, with class 1 being substances of least concern because of expected efficient metabolism or a low estimate of toxicity. And class 3, which is the substances of most concern, and the decision tree typically defaults compounds into class 3 to deal with unknowns with respect to metabolism and toxicity. And class 2 representing a group probably less well-defined in between Class 1 and Class 2. I'd like to put this slide up to let folks know that TTC is really not anything new. Regulatory agencies have been using toxicological thresholds and, in fact, using structure-activity approaches along the lines of what the Cramer decision tree results in for many, many years. This is a diagram out of FDA's Redbook toxicological testing guideline from 1982, and it divides. FDA uses a similar structure activity analysis to divide compounds into three structure categories of different concerns, and then factors in the likely exposure of the compound from the intended use to establish a concern level 1, 2, or 3. And these concern levels actually relate to recommended testing requirements for food ingredients, including flavors. What's different about the TTC is that it aims for a situation where no additional testing would be required, and that's the case with FDA's threshold of regulation, as well as the Monroe analysis that I'll talk about real quickly here. JECFA was challenged in the mid-1990s with looking at several thousand food flavors. And it was clear that there was a need to determine whether or not a more efficient approach to their risk assessment was possible. And they engaged Ian Monroe, who published his paper in 1996, analyzing multi-dose studies on over 600 compounds that were available in public databases. Again, picking the most conservative no effect level and applying a structural classification, both the Redbook classification and the Cramer decision tree. Dr. Monroe determined that the Redbook classification was too conservative to really result in a useful separation of the compounds in the data set. But the Cramer decision tree allowed him to develop probabilistic distributions of safe exposure levels for compounds in each of the three Cramer classes. And very much like the threshold of regulation analysis, Dr. Cramer used a probabilistic analysis to identify three safe human exposure levels, one for each of those classes. Now, rather than using the 1/3, 2/3 risk management approach that FDA used, he established safe exposure levels using a 5th percentile, using a bit more scientific approach. In 1999, I and my colleagues also published an updated analysis of FDA's of the threshold of regulation level. The purpose of that analysis was really to test the effectiveness of the program after several years of experience, and to consider whether the original assumptions about carcinogenicity being the most sensitive endpoint were valid. And also to look at how it might work better. And that paper proposed an approach based on structure activity analysis derived from our analysis of the distribution of compounds that had been extracted from the carcinogenic potency database. So as it turned out, one could make statements about the likelihood for given structural classes being more potent than others. Let me move on from this. At about the same time, a group put together by ILSI Europe was considering the broader applicability of TTC and again focusing on the non-cancer endpoints. They examined the original Monroe analysis and tried to address the questions that had arisen since 1996 with respect to its coverage of specific toxicological endpoints listed here. And generally speaking, Cruz et al. Came to the conclusion that the Monroe safe human exposure levels were adequately protective in each of these areas. Once, based on a public meeting conducted around this particular work, ILSI Europe formed a working group to develop a guideline for application of the TTC. That guideline merged the cancer thresholds that FDA had been using with the Monroe TTC thresholds, included information on structure activity of structural groups that could be excluded or should be excluded at different exposure levels, different points in the decision tree. And so this is the final product of the second ILSI Europe working group. It's in the Cruz et al. Publication of 2004. It shows two different sections to cancer and non-cancer. It includes exclusion of high potency, potentially high potency carcinogenic structural classes, and based on whether or not, and uses mutagenicity or genotoxicity as a decision point with respect to applying the non-cancer thresholds, which are in the lower half. So for organohalide compounds, glad I don't shoot for a living, we have a TTC of 18 micrograms per person per day. For the class 3 compounds, 90 micrograms per person per day. Class 2 is 540, and class 3, the least potent, is 1800. And so this combines structure activity used in FDA's threshold regulation process analysis with a non-cancer analysis. That's usually where I stop in this talk, but I wanted to mention that since 2004, a number of groups have challenged the assumption that the Monroe database, and for that matter the CPDB database, represented the world of chemicals. One such analysis was by the Fraunhofer group. They determined that the Monroe 5th percentile Noel was conservative, as well as for class 3 and class 1. Too few chemicals to make a determination in class 2. Another group, Kalkhof et al., published an analysis which is significant because it includes over 800 compounds, and there's no overlap of those compounds with the Monroe data set. And again, we see the Kalkhof TTC is almost 10 times the class 3 TTC for Monroe. The other two are higher and or comparable, as the case is for class 2 and class 3. And I'll stop there. Thank you.